Kate.
Hey, how are you?
Good. So I know you because we're both in Wapio's course.
Yes.
We're in the same study group. And I know that you're a nurse, right?
hmm Yeah, for
Specializing in
adults.
a nurse for
Uh,
adults.
yes. For hospital setting, anything below the ICU. So if you get out of the ICU and you need to go to a step down level, I can go from there to med surge to women's health to anything, but not children
Okay.
because they're weird and you have to like do math to give them meds. I don't like it.
And how long have you been a nurse?
I got certified or I passed my boards in 2019. So we're coming up on a little past 3 years.
Okay. Yeah.
So
And I brought you on the show because I love how honest you are in the things you do. You have so many stories that take place in the hospital. And I feel like you are just so transparent with what you do. And I remember you mentioned, I think in the study group yesterday, like if we had you as a nurse, it's like, don't have you. But I think I would love to have you.
yeah, but get a new one because it's gonna be weird. I don't know what's gonna happen.
Yeah. Well, let's talk about male genital mutilation, also known
Yes.
as the nicer word circumcision. Did you know that it's illegal for female genital mutilation,
hmm
but not circumcision, of course? Did you know that it's illegal?
Yeah, I did not realize that in my brain when I was going through nursing school and we were talking about these things until I actually saw it. I never like put the two pieces together that they were one and the same because you hear about female genital mutilation and you just think, a woman's being held down in her like back room of her house by like her grandparents and they're just slicing off the clitoris and like it's this horrible debacle. But seeing it in the hospital, it was not it was cleaner, but it was no less like horrifyingly brutal.
When you say
So
seeing, you're talking about
the yeah,
circumcision.
the circumcision.
Yeah.
Because I my rotation in nursing school, I really loved the nursery. I didn't like postpartum. I didn't like labor and delivery. I saw a baby being born um, vaginally. And because I was a student, the only thing I was allowed to do was take the little 4x4s and wipe her poop. So that was my job was to wipe the poop and like push it to the side, which I did well. I was good at it.
You're
So
a good poop wiper. So you witnessed circumcision in when you were in nursing school. It was during your rotation that you had to.
yeah.
It wasn't required, right? But it was just it
Mm-mm.
happened. Okay.
I was in the nursery cuddling babies because I would finish all my stuff really fast. And then I would like run back to the nursery because I just didn't want to be a part of it. I really liked the babies. I liked giving them their first bath. Well, now I feel awful about like, oh, why did I do that? But I had no idea. And then
Why did you feel bad about that? And these babies, by the way, in the nursery, are they in NICU or is it just after?
it's just postpartum.
Okay.
Their mother's given birth. They take them to do a few things. Pediatrician checks on them to give their mom a break. The one baby that I wanted to take home in my backpack was a withdrawal baby. He was incapable of being soothed, and the only way to get him to stop really like cry shaking is to like put my thumb in his mouth and like push on the roof of his mouth. Which I discovered when he was suckling. I just thought he wanted to like suckle, but the pressure on the roof of his mouth like helped him calm down.
Hmm. And when you say
And
withdrawal baby, his mom
Mhm.
was on drugs.
Yeah, she was on Suboxone, methadone, marijuana, heroin, and I think they found some amphetamines in her blood and her urine.
And with moms who have been, on under the influence on drugs, is she still in the recovery room? Like she has access to this baby? Is she allowed to see the baby?
In Tennessee, she was allowed to see the baby. She was allowed to have the baby, but I think CPS was called and they were going to come in and like assess the situation because I think that the mom had from what I remember, the doctor saying the mom had been clean and was doing okay, and then something happened and she went on like a week-long bender towards the end of her pregnancy and caused the baby to come. And the the old sort of like battle axe nurse who's been like a baby nurse for 1,000 years and maybe delivered Jesus, she said that the baby was going to be in the NICU, in the neonatal intensive care unit, within the next 2 to 3 hours. The baby was stable, but starting to sort of like show signs of like an increasing system of failure. Like the rate of respiration was going up, the shaking was getting worse, the screaming was like inconsolable. The baby was in a lot of pain. You could tell the baby was in a lot of pain, which I couldn't tell. I just thought it was a screaming baby. And the doctor's like, no, this baby's in actual like pain. This is what it looks like. I was
Wow.
like, huh, this is heartbreaking.
Yeah.
And I asked the doctor, I was like, can I just put this baby in my backpack? And she's like, I wouldn't stop you, but the police might.
Yeah.
It's tagged. It's like,
Yeah.
okay.
And in the nursery, is it just like the plastic boxes, all the babies are lined up?
Yeah, they're in their little plastic boxes. They have their little warmers. It's this super harsh overhead light that gave me a headache. I can't imagine what it gave the babies.
Yeah. And
And
are there multiple babies crying at once?
yeah, for sure. And one day when we were there, this girl I went to school with was standing next to a choking baby and she didn't know what to do. And the lady's like, that baby is choking. The nurse was like, that baby is choking. And my friend didn't know what to do. And the woman just scooped the baby up like by the back of her neck, because it was a female baby. I only remember because of the blanket colors. And just like stuck her fingers in her mouth and like cleared away and like tilted her this way and like let it run out and like laid her back down on her side. I was like, Jesus.
Was that mucus?
It was just like a collection of spittle that the baby had. It didn't look like mucus. It just looked like spit bubbles that the
Yeah.
baby was
Oh wow.
hyper spitting. I don't know.
Yeah, and that sounds like that's the problem. Even after feeding a baby, you don't put a baby down right away. But I get it. If you're in a nursery and you have a bunch of babies that you gotta formula feed, and then you gotta get to the next one, you're gonna be putting the baby down. So it seems like it's the separation of mother and baby. It's just not.
It's so weird because like the moms would feed the baby and then they'd hold them for a few minutes and then put the baby down and then the baby could come to the nursery so they could have time alone. It's like, what? And have you seen these commercials for this like super bougie, like Four Seasons style hotel where you and your baby can go immediately postpartum for breastfeeding classes, which is kind of cool. But like they'll take care of the baby while you have 5-star lunches catered. And
Where is this?
there's the one that I saw, the commercial is somewhere in like Manhattan.
Oh wow.
Yeah. And it looks like a spa that you would love to go to, but
Yeah.
it's for mom and baby to go. And like they'll let you do what you need to do. They'll take the baby so you can sleep, and they'll do like night nurse type things for the baby. If you're having trouble breastfeeding, they'll show you classes. I think they even do infant CPR, like infant safety stuff. So there are a few things that are really cool, but there are other things you're just like, this feels uncomfortable. This
Yeah.
doesn't feel natural.
Yeah,
And
of
I don't
course
even have
not.
kids. Like, it doesn't feel natural to someone who doesn't have kids.
Yeah.
That's got to be something.
Well, let's get back to male genital mutilation. So you witnessed in nursing school 2 babies, and can you share more about, baby 1 and baby 2, your experience, what you witnessed?
Yeah, for sure. I was so excited to see it. I have to preface this. Like, I was so into seeing a circumcision, not because I wanted to see a baby get cut, because in my brain, I had never connected that it was this horrible thing. And I was so into nursing school and learning all these things. And I really liked the surgical aspect of things. I thought maybe I'll be an ICU nurse, which is too organized. Like, my brain doesn't do the type of organization that's required for ICU nursing, even though I actually have been forced to do it a couple of times. Wildly unsafe. I put the word out. I want to see circumcisions. I want to see what the doctor does. I want to see the equipment used. And so I quote unquote got really lucky because I saw two different doctors do two different types of circumcisions all in the same day. The first doctor was a lovely woman, and she had like this huge satchel of nonsense that she'd like books and like weird shit shoved in there. And she's carrying it, and the nurse is carrying the baby, and we're following in this weird little like circumcision, like surgery train. And we go into this little side room, and they have these plastic formed things that they put the baby in. They strap the baby's little legs in, they separate the little legs and strap them in. She had a strap that went over the body so that the, the arms were sort of stuck like this, or like locked down like this.
Do you
They
know?
weren't.
Do you know how old this baby was? Like how many days?
I think this baby was pretty fresh, like a couple days, like maybe one or two.
Okay.
And I think it's just because this is when the doctor could get to doing it.
Mm-hmm.
I think the second one that I saw was like a day old
Okay.
when they did it.
Wow. So really fresh. Okay. So you see this contraption.
Yeah, I see this contraption and I watch her strap the baby down, and they're getting all their equipment ready, and it's sterile and everything, and they're like laying it out. But it doesn't stay sterile. I don't think it stayed sterile as she went about it. She broke open this little like plastic tubing of glucose, which is sugar water. And I was like, "Are you going to do anything else?" And she's like, "No, I'm just going to squirt this in their mouth."
So no anesthesia, no local anesthesia, no numbing agent.
She may have put in a little like antibacterial like numbing cream at the same time, but I don't remember that part if she did, because all I remember her saying is, "No, this sugar water is all we use." I was flabbergasted. I was like, "If you are going to cut me, I want morphine, all of it," which obviously you can't give to babies, or you shouldn't. Anyway, not the point. And then she used the plastibell method, which is the little plastic bell where they sort of put it between the foreskin and the head of the penis. And then they wrap this string around it because there's a little groove in the part that goes between the foreskin and the penis, the head of the penis. And then they tie it really tight and they cut the excess skin off.
Wait, so let me visualize that. Repeat that again.
Okay, so think of a little plastic ring, and in that ring is a little groove. And then that little plastic ring is attached to little like plastic, fixed plastic tweezers that are holding it in place. So you can easily get it around the head of the penis and the foreskin. They make a little incision too, also, so they can open the skin up and get it in there easy.
When do they make the incision? Before they put the plastic ring on?
Yes, there's a little sort of like, I called it like a weird little shovel looking thing that they sort of put between the foreskin and the head of the penis so they could make the incision. And then they put it in, put the plastibell like ring around, and then they wrap the string around and fit it into that groove. And it's kind of like docking a tail that cuts off the blood flow, and then they cut off the excess foreskin. It stops the blood flow. It basically sort of, yeah, docks the tail, I guess is what you could say. And it just sort of like naturally over time falls off the way the umbilical cord will dry up and fall off. It's kind of a similar concept.
Okay, and is there blood?
Not a lot. It's actually, I was shocked at how little blood there really was.
Yeah, and is the baby crying?
Oh, it is earth shattering. Like the baby is screaming. They would be kicking, but they can't move their legs and their upper body is tied down. So it's wildly unpleasant. And that was the first time I saw it. And I was like, okay, this seems okay. Like, because the plastibell felt oddly civilized. Because in my brain, the string was cutting off sensation anyway. So that was totally unpleasant as well. But it was like cutting off the sensation, kind of like when your hand goes to sleep, you can like poke it or do weird stuff with it. So that's what my brain was equating it to. And I think that's even what the doctor told me. And so that was it. She picked up her satchel of nonsense and like left.
And the baby was still crying.
Yeah, the baby was definitely
who is
still crying.
giving the sugar water? Is it constant,
The doctor.
constant?
No, she just like
It
shoots
was
in
just
a
the
whole bunch of it at the beginning.
in the
Yeah.
beginning.
Hmm.
Okay. I have a statement here. I was reading on Psychology Today, and she busts some myths. And right, the statement is it doesn't hurt the baby. The baby can't feel it. Like, did you know in 1997, doctors in Canada, they did a study to see what type of anesthesia was most effective in relieving the pain of circumcision. And as with any study, they needed a control group that
Hmm.
received no anesthesia. And the
Hmm.
doctors quickly realized that the babies that weren't anesthetized were in so much pain that it would be unethical to continue with the study. And even with the best commonly available method of pain relief study, the dorsal penile nerve block did not block all the baby's pain.
Yeah, it's wild. It was wild because she said the glucose was fine, and then I honestly I can't remember if she did or another doctor did like numbing cream slash like antibacterial stuff, but and then they just sort of like lubed it up and like took the little connector piece that was making it so that you could place it. They took that off and they left the little plastic ring in, and they said that it was cleaner and safer, and I was just sitting there like, this feels rough. This feels weird. Like, I don't know how I feel about this. All I wanted to do was like take the baby and the plastic thing and run away at that point. And I was
Yeah.
like, you wanted to see this?
When they said it's cleaner, did they mean circumcising this baby is cleaner?
No, no, no. This process she felt in her practice came up with less infections and less complications, like less random bleeding, less infections, because the baby is still urinating out of his penis. And the baby, if they have like a wild blowout bowel movement, can get feces on that open wound. And she said in her experience, this was the cleanest way to go about doing it.
Mm-hmm. And so after this baby was circumcised, he's still crying. Do you see them take him out, take him out of the
Yeah.
contraption, and he's still crying? Is there anyone there to soothe him? Is he just
The nurse is soothing him, and then we take him back into the nursery and put him back down, and then at that point I come back and like cuddle the babies.
Mhm.
But they don't really want the baby to be touched so much because they don't want you to like knock the recent procedure or like put pressure on the procedure.
Wow. What's also interesting is the mom isn't even there to help soothe the baby, like putting her boob in.
Not for either of them. I was like, where are the parents? In my brain, I was like, where are the parents? I don't think that they wanted to see it. I think they wanted a circumcised kid, and I think that they didn't want to see what was actually going to happen to their kid.
Of course.
Because I think there's a part of like a primal part of your brain that you're like, this is causing damage.
Yeah. Okay, before we get into the second baby that you saw getting mutilated, why do you think the parents, let's go down the list on why parents think that they should circumcise. Okay.
Mm-hmm.
So let's go down the list. It's cleaner to be circumcised.
I think they're finding that's not actually that true. I think that research is starting to show it doesn't actually trap like STDs like they said it did. It doesn't actually like hoard HIV like they said it did. I think it's just a matter of good hygiene,
Yes.
essentially, and
Yeah.
learning how to take care. Like we have to teach girls how to clean their vagina and make sure that their genital area is clean and dry and has the proper biome. It's exactly the same thing with dudes, only I don't know why. I guess people are lazy because
The reality check is what I learned is that in babies, we know the foreskin is completely fused to the head of the penis, right, when they're born. And you can't and shouldn't retract the foreskin to clean it, as this would cause, the baby pain. And just like you said, it's like trying to clean the inside of a baby's vagina.
Yeah.
So you don't retract it. And the infant foreskin is perfectly designed to protect the head of the penis and keep feces out and bacteria out. And all you have to do is wipe the outside of the penis like a finger. And what was interesting is when Bjorn got hospitalized, Bjorn's not cut, he has remained whole. And the doctor, who I think was Jewish, Zuckerman,
The Zucks.
yeah, he actually was telling me that I should be retracting my baby's foreskin to clean it. And I said back to him, I learned that that's not a thing to do. And he kind of said, well, what could happen, which we're going to also bust this myth, is something called phimosis. So he was like, if you don't gently retract your baby's foreskin, phimosis can occur. Have you heard of that?
Mm-mm.
Phimosis means that the foreskin will not retract. And since children's foreskins are naturally not retractable, it's impossible to diagnose a phimosis in a child. And so if you were to say, oh, your baby has phimosis because it doesn't retract, it's misinformation. And it's often made to secure insurance coverage of circumcision in states in which like routine infant circumcision is no longer covered. Does that make sense?
Yeah. Oh yeah. I understand. Insurance is so weird.
Some adult men, they have foreskins that don't retract, but as long as it doesn't interfere with like sex, it's not a problem at all. And urination itself cleans the inside of the foreskin.
Yeah, because your urine is sterile to you, and it's not actually this hive of bacteria and disease unless you yourself have all that stuff. Like
Yeah.
there's an actual like physiological, pathological problem with you.
And that's why it's important, like even, after having sex, you go pee
Yeah,
to get stuff out or whatever.
because it'll help like flush the system
Exactly. Yeah.
and carry away all that stuff, which is why they use urine after to test if you have issues, because urine can collect all that stuff and like get rid of it. That's the whole point of it. Your urine is the waste product of all this stuff. And so if what you're wasting is sickly, it helps clear it out. But if there's stuff stuck in the tubes, it'll try and help clear that out.
Exactly.
Too.
And so there's another myth that uncircumcised boys get more UTIs. However, the reality check, it's based on this one study. I don't know if you heard of it, but they were looking at charts of babies born in one hospital in 1985, and the study had many problems, including that it didn't accurately count whether or not the babies were circumcised or whether they were premature and thus more susceptible to infection in general, and whether they were breastfed, right? Because breastfeeding protects against UTI. And if their foreskins had been forcibly retracted, which can introduce harmful bacteria and cause UTI. And there's been many studies since which show either no decrease in UTI with circumcision or else an increase in UTI from circumcision. So thus circumcision is not recommended to prevent UTI. And girls have higher rates of UTI than boys, but when a girl gets a UTI, she just is simply prescribed antibiotics, which could be the same treatment for boys.
Yeah, exactly. Well, what about the myth where an uncircumcised man can give his partner UTIs and yeast infections because his foreskin is supposedly harboring all of these bacteria that can damage the microbiome of the female?
I
Have you ever heard that one?
not heard that. I have heard about the smegma, that smegma is dirty, or uncircumcised penises get smelly smegma. Have you heard of smegma?
Isn't that like the zhuzh?
Yeah, it's just like it's like sebum.
Yeah. The sweat.
Yeah. So
I know words.
So smegma is produced by the genitals of both women and men during the reproductive years. And smegma is made of sebum and skin cells and lubricates the foreskin and glands in men and the clitoral hood and inner labia in women. And it's rinsed off during normal bathing and doesn't cause cancer or any other health problems. So, and I feel like, there's a lot of, misconception that, there's going to be all this gunk, but that gunk is not
has a
bad
purpose.
gunk. Yes, it has a purpose.
The thing that I think is so interesting, I think that we're talking about these things like women are having higher rates of UTI and yeast infection, men are having all these issues. And I think part of the thing we have to really look at too is what are we eating and drinking? Because so many of my friends are having chronic and sort of like almost seems like the forever UTI. Like my one good girlfriend, she has had a UTI, and so they put her on a low dose antibiotic forever. I was like, don't take that. That's going to make everything worse. And she's trying to get a hold of her candida. She's trying to change her diet completely, but it's hard because her family's not into it. When we're looking at stuff like UTIs in women because they have an uncircumcised partner, what are the other factors? Like, are they eating weird, not weird
Yeah.
things, but like the normal things? Are they eating for their body? Are they eating what is their life like? Are they stressed out? Are they sick a lot? Do they take medications? So I think all of this stuff I really think goes back to the fact that we ourselves are not that healthy
Yeah.
anymore.
The
So these
baseline is shit.
infections. Yeah, the
People's
baseline
baseline
is
is shit.
fucking ridiculously
Yeah.
bad.
And we have to look at a person like as a whole, the whole system. What are they doing? Not literally like, oh, it's because their partner is uncircumcised. That's why they're getting
Yeah.
yeast and UTI infections.
And then you have to think, if you have an uncircumcised baby or a circumcised baby, what are the parents like? Because the parents are taking care of that child and their habits are that baby's habits. How is that baby being nourished? Not that they're like CPS needs to be called by any means. That's not what I'm saying. But I mean, we have to look at what's coming into the baby because that can affect the baby's system for infection as well. And I don't think that blaming circumcision on a baby that gets a UTI or some other thing, I don't think that it's the canary in the coal mine. Like the baby is uncircumcised and has infections. I think there's completely different things you have to look at.
Did you know that there is no medical organization in the world that recommends infant male circumcision as mandatory or routine?
No.
Yeah.
I thought it was like pediatricians unite for cutting off the baby's penis or cutting into the baby's penis.
Mm-hmm.
I did not know that. Why does everyone talk about it like it is the thing to do?
Because of all of these myths that it's cleaner,
Mhm.
it's better, and I want my son to look like me. You hear dads and partners saying that boys are getting made fun of. I don't want my son to be made fun of because he looks different.
Yeah. Yeah.
The good news is circumcision, routine circumcision is decreasing.
Mm-hmm.
But also, did you know that in most countries, like they don't do it, like the UK, Japan, like it's
Mm-hmm.
not, it's definitely more common in America. America is like one of the dominant countries that where people are still circumcising their baby for non-religious purposes.
Yeah. Well, that's the thing that's kind of interesting. I think our country and New Zealand are the two that allow pharmaceutical companies to actually like have advertisements on TV. And we're such like Wapio was saying today, we're a surgical nation. Give us drugs and do us surgery because all the other stuff doesn't work. There's new evidence that says this is the thing to do. And it's kind of like, that's new evidence of what? Number one, when type 2 diabetes is the thing that's on the rise and it's a lifestyle like issue. It's a full-on lifestyle issue.
And we're just so disconnected with
Mm-hmm.
ourselves, and yeah, it's pretty sad. But
Yeah.
let's not make this a depressive.
Oh, sorry. Let's go back to cutting
Yeah.
baby number two's penis.
Yes, let's go back to that.
No more diabetes. Baby penis cut.
Yeah,
I don't know.
male genital mutilation.
Yes.
So yeah, let's go back to the second baby that you witnessed.
The second baby was a male doctor who did it. And he used this medieval metal contraption looking thing. I don't know what it's called. I think it was called the Gomco procedure because I remember hearing Plastibell and Gomco. I had to Google those things and look them up.
Okay, I'm going to look that up. Go ahead.
And the Gomco, I think, if I'm remembering correctly, is this weird sort of like metal contraption that he used. And it's essentially the same thing. There's no like docking. They don't leave a string around it, I don't think. What happens is they make the little incision, They slide the little metal contraption on, and then they like clamp it down. And then they slice the excess foreskin off. And then that's it. They just sort of like put gauze on top of the little baby's little baby's
Wow.
penis.
Well, let's go back. So this is the same room. Was this right
Same.
after you saw it? This is like a or
This was
different.
maybe like 2 hours later. They're like,
Okay.
there's going to be another circumcision. You want to go? And I was like, yes, absolutely. Because I still have not got it in my brain that I don't want to see these things.
Okay. And is it the same contraption? They're tying babies.
Yeah, it's the same, very same. The whole thing is the same except for the contraption and the ending of the penis.
Okay. They're giving the baby. Okay, so they tie the baby down, arms
Tie the
and
baby
legs.
down, arms and
Sugar
legs.
water is out. So there's no numbing block, or do you think they give the antibacterial numbing
Water.
thing?
I think this guy slathered on some cream.
Okay,
Yeah, I
on the
think he
penis.
slathered on some cream on the penis because this one was a little bit different because this one was this like weird metal thing that they like slipped on.
I'm looking at it. It looks like a wrench kind of thing that they put on, and then there's a metal
like little tie thing that they like secure everything to so it doesn't slip off and they don't just chop it off.
Oh my gosh. Oh, yep. Okay. Yep, I'm looking at it, and definitely the way I'm seeing it, it looks like as if you were to put my finger in, I don't know, let's just say a wrench, right? And you're wrenching on my skin, and that would still hurt. Okay, so is the baby crying?
Oh yeah, it's screaming because these things, also remember, this is a metal thing. It's not only is it heavy, he's tied down, it's cold. Like this metal thing came out of a drawer, not a warmer. It's not warm, it's cold. This baby's tied to a cold plastic board. So the holistically the thing is shocking to the system. I mean, this is a brand new baby. It was in a warm, lovely place. It was dark and cozy and the pressure was nice. And then you get born. I don't know how long you're with your parents, your mom, and then you're brought into this nursery where I pick you up and wander around with you because you're just too cute. And we're just like having a great cuddle time. And then I have to put you back down because you're about to get your foreskin cut off. And they take you out of the little swaddle that you're in. They strap you down to this little thing. They undo your diaper. If the diaper is clean, they leave the same diaper on. I remember that. I was like, don't you just want to get him a new one? Like, what if he like dribbled or something? And nope. And then they did the whole like wrenching down of it, sliced it off, and then took off, unwrenched it, pulled
Is
it
there
out,
blood?
made sure. Yeah, there's actually more blood this time, but it's just like, it's like if you cut yourself on your finger. Not a deep cut really either. And he just put what we call 4x4s. It's just like 4x4 of gauze. Just put that on there and like staunched it, made sure that he wasn't bleeding horrifically, threw that away, got a new one, put it on there, and then did up his diaper again.
So there's
and that was it.
It's just the doctor, I mean, and you watching. Is there like a nurse continuing to give some glucose sugar water in the baby's mouth?
No, it was, I think each time the doctor gave a dose of glucose and then they put the contraption on and then one more like squirt of glucose and that was it.
Do you think that helped the baby relieve pain, or it was still just the baby was crying?
The baby was crying the whole time, squirming, crying, completely like totes in distress. I think I came away from that experience like, I really don't think I would, if I ever were to have a son, I was like, I would not do that to my kid. I would just figure out, because at this time I still thought that the foreskin should be retracted. And I was like, I'm just gonna retract the foreskin, teach the kid how to take care of himself and stay clean. We don't need to go through this. It's just take responsibility for your hygiene and all that stuff. Before I really understood the whole mechanism of the foreskin and the sebum and all of that, and what urine is really for, what urine really can do for the body and does do for the body, given that the body is clean and healthy itself. But it was reason, I would say top of my list is why I wouldn't do labor and delivery, because I really loved being with the babies and I didn't hate watching the birth, even though I didn't really like the nurses too much. But then now that I'm a nurse, I'm like, I don't like any nurses really. So we're entering territory. It was the circumcision that like ended the whole thing. I was like, I could never like send a baby to get cut. I would absolutely like let my opinions show. And be like on my face, the mom would see. But the thing that was really interesting is the male doctor felt less rushed. Like he didn't feel like he was in a hurry. He didn't have his bags with him. He didn't have anything like that it seemed like he needed to do. He seemed like he went slower and he was more methodical about it. I don't know if it's because of the contraption, the Gomco that he did, because the Plastibell feels a little bit less like user error can happen, whereas the Gomco feels like you could really fuck it up if you slip, like, whoa, problems. So his procedure seemed less like hurried, I guess is what I'm trying to go for.
Mm-hmm.
It
And with
seemed
both
like he
doctors, are they talking to the baby, communicating what's about to happen?
they're not communicating. They're just like, okay, baby, we're gonna do. They're just sort of like, it's okay, just like comforting, cooing sounds. So they weren't just like ignoring the baby. They're like, it's okay, we're gonna be okay. This is gonna be quick. I'm gonna get this done quick. Then we're gonna get you back all cozy and get you back into the room and get you back with your mom. So they weren't just this methodical, like, burp, burp. They were trying to do it as quickly as they could, cause as little pain as they could, given the circumstances. I thought they did great. I just thought that it was a fucking creepy thing to do. You know what I mean? So the doctors, in my opinion, did do for what they were doing. I thought it was amazing what they did, if that makes sense.
Yes, that absolutely makes sense. Well, during the conversation, yeah, you were talking about just teaching our baby, our son, good hygiene, and
Mm-hmm.
the a
Thank you.
misconception a misconception is that little boys won't clean under their foreskins and get infections. However, the foreskin separates and retracts on its own sometime between age 3 and puberty. And before it retracts on its own, you wipe the outside off like a finger, like we talked about. And after it retracts on its own, it will get clean during the boy's shower or bath. And
Yeah.
once a boy discovers this cool new feature of his penis, he will often retract the foreskin himself during his bath or shower and, encourage him to rinse it off. And he shouldn't use soap, as this could, upset the natural balance.
Mm-hmm.
And it can be irritating, right? Just like even with women using all these like toxic scented, I even saw like what's douches or something. Like,
Yes.
oh
And
God.
I have douched once or twice in my life because I thought that's what I was supposed to do. My mom did it. She had the little thing, and I was like, I'm an adult now. This is what we do to be clean and healthy and whatever. And it's just like, I used to have a huge problem with UTIs and yeast infections, UTIs specifically after sex and all that. And then, and so I thought douching helped, which made it way worse. And I just thought that it was something that needed, attention, medical attention. And it wasn't. It was like the douching was throwing everything off. My diet was horrible. Everything was just like completely off. And then once I sort of like started realizing that and working on other things and fixing those things, like I haven't had a UTI or a yeast infection in years. And I even have moments where I eat horrible, but because like I come back to it and I know how to like eat appropriately, like a healthy human, it doesn't really do the damage that it could if like I ate that way all the time.
So you witnessing those two procedures of babies getting mutilated, parents would say, oh, my doctor uses anesthesia. But from what you said, they're just getting this sugar water. And from what I've read, most newborns don't receive adequate anesthesia. And only 45% of doctors who do circumcisions use any anesthesia at all. And like obstetricians, they perform 70% of circumcisions and are least likely to use anesthesia, and only 25% do. So the most common reasons like why they don't, and they said that they didn't think the procedure warranted it and it takes too long.
Yeah. So, I mean, that procedure for both of them, it was a total of like 3 minutes for both, like so fast. And so that's why I think they rubbed a combo. If they did use anesthesia, they rubbed a combo of like topical anesthesia that could sort of like sit there and go as the process went on, not just during the circumcision, but after, like the after effect. The topical could still work a little bit there. But I did not see a syringe during my procedure where they like injected the foreskin or the head of the penis. I did not see any syringes. And I was like, are we? And in the first one, I remember asking, what kind of painkiller do they get? And she literally said glucose. And I was like, is that even a real thing? How is that helping? What does that do?
It clearly isn't if they're crying their heads off.
Yeah. And they had little baby and like 1 day old, 2 day old lungs. I was like, Jesus, this is loud. During the ones that I saw, it was either zero things or topical, but I saw zero syringes. I did not see any lidocaine injections or whatever it is they would use for local anesthesia in that sense. So if one was ever used, and I'm just blacking it out, it had to have been a topical ointment because I know that I did not see a syringe. I would need to be sedated.
Yeah. So if you had a friend, a sister, and they had a baby boy and they were considering circumcision, what would you tell them?
I would be like, do you want my opinion on this? And if they said yes, then I would explain the whole situation. Like, I saw two. This is what happened in my case. I don't know if this is across the board. You could get a completely different situation or scenario. And this is what I know about foreskin for for infants to boys, and then how to keep men clean and quote unquote clean. And this is why I don't think that it's that great of I think it's a terrible idea. And I think that it could be causing damage to your son in the future.
And when you say
then
damage, are we talking psychological, physical?
I think both. I think that it's such a traumatic thing to be tied down and then to be cut, like have a piece of you removed. I feel like that would be so damaging. And if you, in the whole, it's a baby, he's never going to remember, I feel like that's so dismissive of the human experience, which I did not believe in for during nursing school. Like, I was like, it's a baby, he won't remember. But as I move along in these things, I'm like, shit, man, it'll come up in some other weird way.
I feel like the bottom line is parents, mother and father, do not have a right to decide on their babies being mutilated. Parents do not have a right to make that decision before the baby can even make their own decision.
Yeah.
Let them decide when they're older.
If that's what they want to do, because it's not going to be the only reason that it would be any more traumatizing for a man is because a man can get hard and it could cause disruption in the healing process. That's it. But if he wants to make that choice, then he needs to make it. My dad had a friend when he was in the Air Force. The friend of his was uncircumcised. They're like in their early 20s, maybe 20. And this man had a fiance who's like, I will not marry an uncircumcised man. I don't understand, like, whatever. So he got circumcised at 20. And my dad is such a dick. They took him to a strip club and after his circumcision, and he started getting aroused, and he said that his friend was screaming like it bloody murder at how painful it was, because he had soreness, obviously, but when they took him, I think they took him to, because this was in Okinawa when it happened, so they took him to some sort of like strip club / brothel thing. They were laughing and he was screaming. He's like, this is the worst thing ever. So I mean, think twice. Like,
absolutely. Yeah. I think male genital mutilation should be illegal.
Yeah.
We should protect infant boys. and yeah, should be outlawed.
It should be frowned upon. And I mean, in religious circles, I think Angie was right. I don't think that they actually like removed the skin. I think that they made like a cut to show that you belong to the tribe. I don't think that they had this whole process where they excised a portion of the anatomy.
At least back in the day, yeah, they didn't even remove the whole thing. They cut just a part of it off if they
Mhm.
were to take it off.
Yeah.
Yep.
Yeah.
Thank you, Kate,
Yeah,
for
thank you.
sharing
This
your
is
experience.
Thank you so much.